All right, the time now is about 4 o'clock p.m. on Thursday, August 24th. My name is Asia Simpson. I am the Wellness and Benefits Consultant for Montebello Unified School District. And today's session is going to be essentially on how to submit complaints or requests for second opinions to the California healthcare regulators. And this session is recorded, so anyone who joins late or has to leave early or misses any portion of this session will be able to review the recorded session that will be sent out from the Montebello Unified School District Benefits Department. So that will be sent out between Friday and Monday of next week. So without further ado, we will go ahead and get today's session started, and I am going to share my screen here for us to get moving with today's content. All right, so in today's session, what we are going to cover as an overview, we're going to first look at what the insurance types are so that we can have an understanding of the two different types of insurance plans that are regulated by the state of California. And then we'll talk about how the California regulators distinguish regulating the different health plans because they are different based off of what type of health plan that you have. And then we'll look at how these entities can actually assist with helping to meet your healthcare needs in the event that you experience challenges with your health plan. We will look at the differences between submitting a complaint versus an independent medical review and talk about what those both are. And then we'll briefly go through how do you submit a complaint and or an independent review, what happens next, and what are some of the resources. And if there are any questions in the end, we will go ahead and answer those. Okay? All right. So the insurance health plan types. Now, if you attended any of the workshops that we conducted in the past few weeks, then you'll know that we talked quite a bit about insurance plans and what plans are actually available through Montebello Unified School District. And the Montebello Unified School District's plans are administered by CalPERS. And so there are a variety of plans with a mix of HMOs, which are health maintenance organizations. And essentially, an HMO is a type of health plan that usually limits coverage to care from doctors who work for or are contracted with that specific HMO. And generally, it won't cover any expenses that are out of network or outside of the plan contract, except in the case of an emergency. And then the other type of plan options that CalPERS offers is PPOs, which are preferred provider organizations. And if you attended our sessions before, you know that a PPO does offer a lot more flexibility. So you are not constrained to just seeing providers or going to facilities that are contracted within the network. You have the flexibility to see doctors in or out of network. And so what that means is the cost of those plans may be a little bit more expensive in order to be able to do so, but you are not restricted. And so because of those two different types, they are regulated by different entities within the state of California. So let's take a look at first, what are the actual plans? Because you really need to know if you decide to submit a complaint or a request for an independent medical review, who do you need to submit it to based off of what type of plan you have? So the HMOs that are offered through CalPERS are Kaiser Permanente, both of the Blue Shield plans, the Plus and the Trio, both of the Anthem Blue Cross plans, which is the traditional and the select, Health Net Saluti Mas, and both of the United Healthcare plans. Those are all HMO plans. And out of all the plans offered, the two PPO plans are PERS Platinum and PERS Gold. So if you have either one of those plans, when we start talking about who regulates who, you'll have an idea if you need to submit any type of complaint or independent medical review, you'll know which entity you need to approach to be able to do that. Okay. All right, so let's go ahead and get started into who's who. So who regulates the insurance carriers? So HMOs are regulated by the California Department of Managed Healthcare. And the vast majority of plans through CalPERS are HMOs. So they pick up the brunt of who they manage in terms of plans. PPOs, for the most part, are regulated by the California Department of Insurance. So that's CDI. Now, if you, for example, make a mistake or don't know, or you're just not sure and you decide to submit your complaint or your request for independent medical review through the Department of Managed Healthcare, and the DMHC, for short, determines that it is not who they oversee, or your plan is not who they oversee, then they will actually forward your request to the California Department of Insurance. Now, I'm not sure if the California Department of Insurance works the same way as the DMHC does, but just know that if you do, when in doubt, you can always submit through the Department of Managed Healthcare. And if it does not fall in their jurisdiction, then they will forward it to CDI, okay? All right, so how can these entities really help assist you with meeting your healthcare needs if you experience issues with your plan? Well, there's a wide variety of ways that these regulatory bodies can actually help you. And when we look at, in just a short moment, we're going to pause from the presentation and look at the website so that you can get an overview of what resources are there. But there's a wide variety of ways in which you can get some assistance. You can do any of the following things depending on what your need and your plan type is. You can file a complaint. We've been talking about that, as well as the independent medical review. You can ask questions just in general, just about plans, plan types, questions that you think, you're not really sure whether or not can be handled by your health plan. Any of those types of questions, you can contact the Help Center for either one of those entities, and they can answer questions. You can also submit complaints against the providers. We've been talking really about health plans, but if you experience issues with your provider or a facility, you can actually submit complaints against them as well. If it's something that is pretty much unacceptable, you can submit it and take action that way. You can also research insurance options. For Montebello Unified School District, I provide a wide variety of support to employees trying to make decisions between plan options, but I can help only so far. So there are certain things that the governing bodies can help, and they go outside of medical insurance. And so when we look at the websites, and when you go on the website, you will find that there are things such as pet insurance, property and casualty insurance types of questions, and information on options in your area. There's a lot of information that can be obtained by visiting these sites. And so what I'm going to do here is I'm actually going to stop the presentation piece of things just so we can take a second to look at the actual websites themselves. So I'm going to share the websites so that you can see what the web pages look like and what kind of resources are actually available. And so what we'll do is we'll start with the California Department of Managed Healthcare and look at their page. So the web page is going to be dmhc.ca.gov, and this link is actually going to be linked into today's presentation, so you can look at it at your leisure. But here is essentially how the page is set up. So you can file a complaint, you can find information on healthcare in California, you can do data and research, licensing and reporting, all types of information. But if you select file a complaint, the first two things that you can do is you can file a complaint, and you can get the forms for the independent medical review as well as the complaint. And then it'll show you how to file a complaint with your health plan. Now, this is not the same as filing a complaint with the DMHC. This is how do you go through the process of filing a complaint with your actual health plan carrier. So you have to go, let's just say, go through the grievance process, and you don't really know how to do that. The obvious initial action would be to contact your carrier, but some people don't really go that route, and so this is another option. It will give you the links to filing a provider complaint, and then there are frequently asked questions. There's other good information in here to help educate you around healthcare in California in general. So that will be information on Covered California, enrollee rights, how to best use your coverage. It has information on what we have talked about in some of our presentations, including a bit from today regarding HMOs versus PPOs. There's also information on low or no income options, and people who are uninsured. And then there's contact resource lists. There's a variety of other information or access that you can get to searching independent medical review decisions from the past. So they do post that information. You can also get information on consumer rights and complaints of IMRs that actually has aggregated data from, over time. And then there's information about licensing and reporting. You can get employee assistance program information. So there's a lot of information here for you to access to be able to get what you need to be able to just be more educated about what your rights are and what is available to you. There's also information for the California Department of Insurance, which is insurance.ca.gov. Also, this is linked in the presentation deck for today's session. It'll be in the resources section. But there's quite a bit of information. Again, they have something similar to the DMHC where you can file a complaint, which you would, once you click on that, their site is a little bit more simple in terms of clean cut. And we'll look at a few of the differences in terms of how to file a complaint here shortly. But there is information here on filing a complaint, and you would go through this process, and we're going to walk through the process of how to file a complaint later on in the slides. But there's also some really good information for consumers. I mentioned just a slide ago about how these websites can not only help you with filing a complaint against your health plan or provider, or submitting a request for an independent medical review, but it also provides you with information on things that are outside the realm of medical information. So you can get information for yourself for pet insurance. You can find out information on dealing with catastrophes, homeowners and renters insurance. You can find out things such as different specialty and niche type of insurances. So the websites provide you with a wide variety of information. So I thought I would just kind of show that so you can see what the websites look like, because we'll be going through the steps of how to submit the complaints and whatnot. But I wanted you to know what these websites look like so you know where to go when it comes time, or if it comes time for you. So I'm going to stop share on the actual websites, and we'll get back into the actual slide deck here. So let me just pull the slides back up again and hop back in where we left off. And we will share screen here. All right, so let's talk a little bit more about what the focus of today's session will be, in light of the fact that I mentioned there are several different ways in which the California Department of Insurance and the California Department of Managed Healthcare can help you. But there's a lot of different areas. But what we're going to focus on today is really going to be around filing a complaint and requesting an independent medical review. Those are going to be the two areas that we focus on. And what we're going to do now is just focus on first the differences between filing a complaint and requesting an independent medical review. So in overview, when you submit a complaint, before you do, health plans are required by law to have a grievance process in place with your health plan in order to help resolve any issues that you have, any complaints that you have, and they're supposed to by law do that within 30 days. Well, we all know that sometimes that just doesn't happen. And sometimes it doesn't happen in the way that is most advantageous to you based off of the circumstances. And in most circumstances, you are required to file a grievance regarding each issue or request with your health plan, and go through that 30-day process with them before you actually submit a complaint to either the California Department of Insurance or the California Department of Managed Healthcare. So typically you have to do that first. However, there are some situations and some exceptions to this rule where when there is an immediate threat to your health, or your request from your health insurance was denied as experimental or investigational. Those are two scenarios in which you don't typically have to wait to go through that whole 30-day grievance process with your own health insurance plan. In the exception situations, you can go ahead and submit your complaint directly to CDI or DMHC, even if you haven't gone through the whole 30-day process. In either of those instances, if you have questions or pause for thought about whether or not you are in a place where you can submit a complaint, you can contact the help center for both the DMHC or the CDI to find out for sure. And keep in mind, as I mentioned before, if you have a health plan and you just really don't know which regulatory body you should be reaching out to, you can always start with the Department of Managed Healthcare. And if it is not within their jurisdiction based off of your health plan type, they'll refer you to the California Department of Insurance. And just as a quick recap, the Department of Managed Healthcare regulates all of your HMOs, and CDO or CDI regulates for the most part, your PPOs. Okay. So what types of complaints can you submit to CDI or DMHC? Well, some of those things include improper denial or delay in the settlement of a claim. If you've had health claims that have been denied by your health plan because the service or the treatment is not covered under your contract. Legal interpretations of policy language, provision, and terms, bad faith allegations or other demands for extra payments under your health plan. A lot of that has to do with legal action that's taking place. Alleged illegal cancellation or termination of your policy, alleged misrepresentation by an agent, broker, or solicitor, alleged theft of premiums paid to there's a variety of things, including issues with providers, medical groups, and pharmacies. I think that's probably what a lot of people, if they are submitting a complaint, is usually around that. So those are some of the areas to kind of think through. And again, when in doubt, you can always contact the help center and just and talk to someone to find out, hey, would this qualify as a consumer complaint that I could submit through the process? And they're happy to assist you with that. So how do you submit these complaints? Well, whether we are talking DMHC or CDI, I'm going to tell you right out the bat, online is going to be the fastest, the quickest, most effective way to submit your complaint, whether we're talking Department of Managed Healthcare or California Department of Insurance. Now, with the DMHC, you have more options. You can do it online, by mail, or by fax. And then with CDI, you can do online or by mail. Now, I will have the actual paper forms included in a link and the resources section of this presentation, so you can access it here, or you can go to the website and kind of hunt it down there. But I'm going to say once again, submitting it online is really going to be the fastest, most effective, as well as the highly suggested way for both of the regulating bodies. They're going to refer you to do it online. Okay. So here's what the process is going to look like. Okay. So if you are submitting a complaint, if you are deciding to go ahead and do it old school with snail mail or faxing, what you'll want to do is you're going to want to download, print, and complete the complaint form with its entirety, and gather all of your supporting documentation, and you are going to want to mail it or fax it to the respective regulating body. So the mailing address and the fax number is going to be on the documents that you would download and print off. And like I said, the links for those PDFs or for those documents is going to be in this presentation. However, if you are submitting online, you will need to use that particular regulating body's platform that they have set up to submit online complaints. And it's usually they have that forefront in the front. When you click on the link to go to their webpage, you'll see that it'll be easy for you to access where to file a complaint. There won't be any question on where to go to do that. So you'll submit their the complaint, and generally the questions that you will see in the actual PDF document, they're going to be the same questions as what you would see online. And if you are submitting supporting documentation, of course, it will have to be in the formats that they accept. And generally, most places that allow you to attach documentation, usually they accept PDFs. So make sure you have those saved on your computer. And depending on the system that you use, whether we're talking CDI or DMHC, Department of Managed Healthcare, one or both may require you to set up a profile before you go through the process. And really, that can be helpful for you because once you submit your complaint, if you have a profile in general, you'll be able to log into your profile and check the status of your complaint as things, as time goes on. So you can, generally they do send you acknowledgement in the mail to let you know that they have received your complaint or your independent medical review. But you can check the status as you go along real time by logging in. So it's a good idea to make sure you set up your profile. And in general, consumer complaint decisions are usually provided within 30 days. Now, that's provided that they have all of the documentation that they need, and they may request additional information from you. I've even had this situation. Now, this wasn't with a complaint, but it was with actually, it was with a complaint. I submitted a complaint against my health plan, and they did actually call me, and I talked to them on the phone, and they had additional questions they input, and that did help to expedite it. So, and that was within the 30-day time frame. In fact, my situation was resolved less than that, but they do have 30 days to resolve that. Okay. So with an independent medical review, so essentially, if you missed the first part of the session or you just didn't grasp what I was describing earlier, an independent medical review is essentially a process in which you have an expert independent medical professional who is not a part of your health plan. They're not attached to it, so they don't have any bias. They are selected by whichever regulating body you're working with to review all of the information, as well as the decision that was made by your insurance company. And they will take a look at it to determine whether or not, it should have been ruled in your favor, or if what the insurance company, the insurance plan has established should stand. Now, if your health plan denies your request for medical services or treatment, you can file the grievance and the grievance appeal with your health plan. And if you disagree with your health plan's decision, and it has been at least 30 days, then you can submit this IMR with the DMHC or the CDI. And so they'll determine whether or not, when you submit your independent medical review, if it qualifies for an independent medical review. Okay. So your request will qualify for an independent medical review if your health plan denies, modifies, or delays service or treatment because the health plan determines it not medically necessary. That's an important thing to keep note, because I'm going to mention something that might sound a little confusing, and I'll clarify it. Your request will also qualify if your health plan will not cover an experimental or investigational treatment, and if they will not pay for emergency or urgent medical services that you have already received. Okay, so those are all areas in which you would qualify for independent medical review. Qualifying for an independent medical review does not necessarily constitute that it is ruled in your favor, but it does constitute that it qualifies for someone else to take a look at it to make sure that the health plan was not in error. Now, the IMR process cannot be used for an insurance company decision that is based on a coverage issue. Okay, so that basically means if it is something that is within your is or is not within under your healthcare policy. This is really about medical necessity. Okay, so this is a service that it is covered, but they deemed they weren't going to cover it because it did not qualify as being medically necessary. And generally, when they deny it for medical necessity, if you're with a health plan, a lot of times they'll ask for additional information from your doctors, historical information, and you provide it to the health insurance plan. And they're like, okay, looking at the historical information from the provider, then they make their decision one way or another. Okay, sometimes they deny it right out because they have their own standards, but a lot of times they'll ask for additional information from your doctor. And you are required to exhaust your own internal appeals and grievance process of your particular health plan first before you apply for an IMR with either the California Department of Insurance or the Department of Managed Healthcare. So either one, you do have to go through the grievance process first before you submit your request for an independent medical review. Okay. So again, going back to, okay, well, what does this process look like? Or actually, before we get into what does the process look like, well, what are the ways in which you can submit it? So it's very similar to submitting and filing a complaint. In fact, with the Department of Managed Healthcare, where you submit your complaint is the exact same place that you submit your request for an independent medical review if you have one. And the three ways in which you can do that is online, mail, and fax. With the California Department of Insurance, online and mail are the two options. But again, I'm going to say this again. You really want to submit your complaint or file your request for an independent medical review online. By far is going to be the fastest, most effective way to do it. I've done the process. It literally took me, for my circumstance, about 5 minutes to do. Now, of course, it could vary based off of your situation and if you have all of your supporting documentation. So, it could take, and if you need assistance, you can always call the help center for that. Okay. And they will assist you. So with requesting an independent medical review, here's what the process looks like. So very, 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 very similar to submitting a complaint. Again, if you're mailing or faxing in your complaint, you'll want to download, print, and complete the complaint form, which again, it is in the resources section. I've linked it in the resource section of this presentation deck, but you can also find it on each of the respective governing bodies or regulating bodies' website. If you're submitting it online, you'll need to, again, use their platform, set up your account profile if they require it. And your application will essentially be reviewed and you'll get an acknowledgement letter within 7 days of submitting your request for an independent medical review. That is not a decision. That's them saying, hey, we received your request. We have it. We are taking a look at it. And essentially that's helping them to determine whether or not they need additional information. So there's two types of independent medical review classifications. One is expedited, and for expedited IMR decisions, they'll provide decisions within 7 days after they have determined whether or not your case qualifies for an IMR, and if they have all the appropriate documentation. Okay, for non-expedited IMRs, they have up until 45 days to provide a decision on whether or not they will be doing an independent medical review based off of the information you submit. So I want to take us just a moment here just to pause and answer any potential questions anyone might have with regards to any of the content that we have covered thus far. Are there any questions? I'm just going to check out the chat box here. Feel free to take yourself off mute if you do have any questions and let me know what you might need clarity on. Okay. Doesn't look like we have any questions, so let's take a look at the resources section here. All right, so as promised, the resources section does have the links for both the independent medical review and the complaint form, the actual physical form. But again, I suggest you use the online portals to submit it. And if you're feeling a little bit uncomfortable about the online piece of things, you can always view the video tutorials. Both state sites have video tutorials on what the website looks like, what this process is going to look like. I've linked the YouTube videos that both of these organizations have created for consumers to review so that they have the information that they need. Looks like I'm missing a 0 here, so I'll add that in there. But I've also provided the websites for both of the California Department of Managed Healthcare as well as California Department of Insurance, and the telephone numbers as well, where you can contact someone directly, get their help center, be able to talk to someone who can help you if you have any specific questions or you really need to talk to someone voice to voice. So This is a wealth of information here, and hopefully it will be very, very helpful to you. And without further ado, that concludes the content of today's